So my uncle died last night. He was in his 50s, or late 50s, I would say, mid to late 50s. I think he's younger than my mum. I think he was the youngest. Um, he came from a village. He used to live in a village called Twyford. He's got two boys. He liked shooting, fishing, going to the pub, that sort of thing. He worked as like an oil, no, not an oil driller, but like a borehole driller. Like when they want to do like construction or stuff, or they like they will test the soil like deep down in the ground to like find out what's there or something. So they drill these, like they use these massive drills, like drill deep into the ground, kind of like an oil rig, and that's what he did for a job. But he was a fan of having a drink, and I don't know if this has anything to do with his illness, but I think it's possibly the reason why his wife, when he first became ill, his wife kicked him out, which was really surprising and really a shock. It was such a shame. He went back to live with my nan, and so my granddad died about 10 years ago. That one, from what I can tell, it wasn't the NHS's fault. It was just a natural death. But even again, that was weird because they couldn't like tell why he died. They couldn't just say, "Oh yeah, it was natural causes." It was like some complicated thing that was hard to understand. He just died suddenly in his sleep. My nan's still alive. She's about 84 now, I think. Went round to see her like a week ago. Then the day after that, my dad went into hospital because he couldn't eat anymore. We'll get onto that. But my uncle had basically flesh-eating bacteria got into a cut on his leg and made a big hole in his leg or something. And he may have had sepsis. I don't know. I can't remember. But he was ill. And then he got better. Then he went home. Then like months later, or perhaps a year later, he went back into hospital, and it was like he was like having a medical emergency, like as if his kidneys were like shutting down or something. And I don't know what was causing it, and I still don't know exactly what happened. But basically, then I was told that they found that he had cancer, of like prostate cancer. But to me, it sounded like that wasn't what caused this, like him to go into hospital. That might have been when he had sepsis. But why did he get sepsis? Because this was just the information that I'm getting. It doesn't make sense. But for me, what it sounds like is something's happened to his immune system, and his immune system isn't working properly. So he's getting all these infections and cancers. But the NHS has never said that. They've never like diagnosed him as having some kind of immunodeficiency or anything. Well, now he's dead, but what they did do is they did a heart surgery. They replaced like a valve in his heart or something with him, and they used a metal one. So they were saying recently that they can't do an MRI to check where the cancer's gone because he got worse, because they put a metal thing in his body, so they can't do an MRI anymore. So it's like they chose to do a heart operation instead of treating the cancer, and now he's dead. It's fucking retards. And they haven't establish the root cause, like what caused him to get this flesh-eating bacteria infection, because I don't believe it's random. I don't believe it's just a random chance that anyone could have it. I think it's something within the body that facilitates it, because I remember seeing it on the TV once, and this woman rubbed her eye. She was gardening. She rubbed her eye and she got this flesh-eating bacteria infection in her eye, which is not good. But she was very old. She was quite old, at least 60s or at least 50s, 60s. So I'm thinking, well, older people have a weaker immune system. So I'm thinking that's what could be, and maybe this particular woman had a very weak immune system. So that could have been what caused it in her case. And I'm just looking at this NHS and I'm just thinking, what the hell are they doing? Like, they're just clueless. They're just like balancing all these fucking plates at once, and they have no idea what they're doing. My dad has a similar problem. I mean, both my uncle and my dad, they both got ill in 2021, so about 2 years ago. So it was after 2020, and I know that I don't know about my uncle, but I know that my dad took the Wabbajack. He got hit with the Wabbajack. Okay, he chose to do it. So if you've played Skyrim, it's like a legendary artifact that causes like random effects when you use it on someone. And yeah, my dad got cancer of the jaw. But again, there was this massive confusion as like where the cancer had started and like what type of cancer it was and stuff. And they said it was like a squamous cell or something. I don't know. Can't remember, but they treated it and he had like radiation on his throat and whatever. Radiotherapy, chemotherapy. He had like a feeding tube at one point because they thought like his throat he wasn't gonna be able to eat because of the radiation, but like damaging the throat. But this was like early last year, I think. It was either late 2021 or I think it was early 2022, early last year. And it took a few months for all the therapy. And they declared him like cancer free or whatever, like you're okay, we've got rid of it. But as I said, it seemed to me like they kind of didn't really understand what was going on in the first place. Then we thought, well, he's okay, he's fine. Like 6 months went, 3 months went by, 6 months went by, 9 months went by, and the doctors didn't say, oh no, it's come back. They didn't find that it had come back, so we thought he was fine. And then in the past month or two, he's started to have problems eating, and he thought it's just like the damage to the throat from the radiation, although it would be weird that it would still be affecting you that much. It's like it's gotten worse, whatever. His like problem swallowing or whatever has gotten worse. And yeah, he was checked a few months. He told me he was checked in August. Basically, he was like throwing up and he couldn't get food down. And I thought, that's not your throat, because if it was your throat, you'd spit it right out again. It's like when I can't swallow a pill, when I fail to swallow a pill, I just cough it back right out again. You don't like throw up. So I realised it was probably further down than he thought it was. But it wasn't until like 5-7 days ago, when he could no longer eat anything, that he suddenly went into hospital, and he's been in hospital since. And they've said, like, yeah, your cancer is spread to your bones and we can't do anything about it. Or rather, we can do things about it, but we can't cure it anymore. So it's gone from having no cancer to having this lump in the esophagus that's preventing him from eating. That seems, initially it seemed like it had suddenly grown since August, when he says his throat was checked then, and a scan was done then. Now I've spoken to him today on the phone, and basically said that they didn't check his whole body. They didn't check his whole upper body. They just checked the area where the cancer was in the throat. Like, the camera didn't go down far enough. That's why they didn't find it. And they did MRIs or whatever, but only on the head, on the throat, like the area where the cancer originally was. So I don't know when. He thinks it was last year, the last time he had a full body scan, a full body CT scan. He thinks that was last year, which is ridiculous. Like, it's only been, what, 18 months, a year, 18 months, 2 years since he first got or had the or finished his treatment. Like, why the fuck are they not checking his whole body frequently to make sure it hasn't come back? Because obviously, like, about a year to 2 years to 3 years afterwards, that's the most likely time when it's gonna pop up again, and it might not be in the same place. Especially if there was confusion about how it started with the first place. So I think they've really let my dad down here. I think this ridiculous that they haven't done like a full chest scan in the past 6 months or even 9 months. I mean, this, I don't know, because I don't know the exact. He could have told me the wrong thing, but from what he said, he hasn't had. I mean, he's kind of old, so his memory's not as good as it used to be, but he hasn't had like a full body scan since last year, which is ridiculous. It's November now. It's nearly the end of the year. It's fucking ridiculous. If this was America, I would, if this happened to me and this was in America, I would be suing. I would be suing them. Because he said, oh, the reason they didn't look like far enough down is because that's not their like department. It's like I've been dealt with by the throat and mouth and whatever department, and the esophagus department is a different department. It's like, what the fuck? Like, a doctor should be able to do everything, not everything, but certainly in terms of like looking for cancer. They shouldn't be like focused on one specific fucking part of the body, should they? They won't be able to do their fucking job properly. It's like, oh yeah, my job is to check for cancer, but I can only check your toes. Like, what the fuck? It's fucking stupid. Yeah, we'll check your toes like once a year. Fucking idiots. So yeah, I'm waiting for more information, but Oh, the other thing is they haven't put a stent. I thought they put it in already. They were going to do a stent, to basically push the esophagus open wider to bypass this cancer problem, this growth. I thought they'd done it already, but no, they haven't done it yet. Because I heard he'd been eating more, but they haven't done it yet. So he's been there, I don't know, 5 days now, 6 days maybe, and they haven't done it. And obviously they need to get him to eat, right? They need to do surgery or whatever they need to do whatever they need to do to deal with this growth, yeah. But he's not been eating properly for weeks, so he's lost a lot of weight, so he needs to eat. So they need to get this fucking stent done as soon as possible, and then they can do the cancer treatment as soon as possible. But it sounds like they're leaving it till Monday. My mum said, oh, it could have been done yesterday, and then he might be she was saying, oh, he might be home yesterday. So it just sounds like it's being delayed not because they don't have the facilities to do it, but because it's overburdened and they don't have enough staff, or they have too many patients wanting that procedures. So that's what it seems like to me. I think if you were in private healthcare, it would have been done already. That's just what I'm guessing. That's just what I would guess. It's ridiculous though. People in the UK say like, oh yeah, the NHS is the best thing about our country. It's rubbish. It's just got a lot worse. It's a lot worse than it used to be, and it just gets worse and worse. They went along with the whole Wabberjack thing, and they've turned their thing into like a rainbow flag, wasn't it? And I just see it as this bloody lorry went past yesterday, and I just saw this like NHS fucking thing on it. It wasn't. I don't think it was an NHS lorry or anything. They just put it on there for no reason, and it just pissed me off. It just reminded me of 2020. And yeah, I don't think you can opt out of the NHS. That's the thing. You have to pay for it. You have to pay taxes for it, even if you don't use it or if you don't like it, or if you want. I think even if you go private, you still have to pay the taxes for the NHS, which is stupid. I don't know exactly, but I'm guessing that's how it works. And in my case, they've let me down as well. So I was physically healthy pretty much until I was 27, and in 2015 in September I suddenly had this viral infection. I was cycling a lot at that time, and I was pushing my body quite hard. I'd had a lot of like anxiety issues that year, but I'd kind of got over it. I had like panic attacks and things, which wasn't normal for me, but it was in the context of having like other mental illnesses for like 4 or 5 years prior to that, so it wasn't like completely it wasn't complete change to what I was already experiencing, but the anxiety was different. It was like I was constantly moving and like walking back and forth, and I couldn't sit still, and it was I guess it was tiring, but I was very physically healthy at that time. But yeah, I suddenly became ill with this virus, and then it made me throw up, and it made me like have labyrinthitis, which meant I lost my balance and had to keep like leaning forwards, otherwise I'd feel like I was falling over backwards. And I just felt really ill, like I could barely walk to the garden. And that lasted a few days, and then it got better. But then as that sort of started to feel like it was going away, it then started suddenly, when I started to do more stuff again, it felt like it was coming back again. And that was the start of the chronic fatigue syndrome, which basically comes and goes in like cycles. So when you do too much, you feel really ill. Then when you rest for a day or two, you start to feel a bit better, and then the more you increase your activities, it kind of gets worse again. The symptoms get worse, and then you have to rest again. And the symptoms kind of vary over time, so I started getting like arthritis and stuff. Not like kind of like arthritis, and all kinds of weird problems in like light sensitivity, just feeling really uncomfortable, like lactose intolerance, bloating. When I was very, very ill in 2016, I was getting worse for a period of about a month. I was getting worse. I was like lying down most of the day, like playing games, but I seemed to just get worse and worse. And there was a struggle just to assemble like a gaming chair or something. And I remember sitting here, and just sitting there was like felt draining. And then I became very, very ill, but luckily I got over it. But I was like completely unable to leave the house. I would walk downstairs in the morning, then walk upstairs at night, and pretty much wouldn't move apart from that. And it was like I would have nightmares or stuff about like climbing over a fence or something, because like activity of that level would cause like severe symptoms. It wasn't a nice time, but I went to the doctor like literally within 1 week, or within 1 week of it starting, and they did blood tests, like tested like immune parameters or whatever to check if you have an infection or something. They did like standard blood tests, and the doctor told me, I think it was like an older doctor, he told me like I had post-viral fatigue syndrome or something, and it would probably go within 6 months, and it would help if I exercised, which turned out to be very like bad advice. And after about 9 to 12 months, I figured out that it wasn't post-viral, it was this thing called chronic fatigue syndrome. It was this thing called chronic fatigue syndrome, and it's a pretty serious illness that can make you very disabled, and it's kind of random, it's kind of unpredictable. But I got slowly better. I learned how to manage it, and I was doing okay. I was doing okay by the time I went to prison. Oh yeah, by the time by this point I'd stopped like bothering to ask them for a diagnosis, because I knew that they would send me to these specialists and shit, which would be a waste of time, and it would potentially make me worse, make me more ill, and I couldn't risk it. And I knew that even if they diagnosed me with chronic fatigue syndrome, they wouldn't be able to do anything about it because there's no treatment for it. So I never got diagnosed, but since I went to prison in 2020, and then I was basically on remand, so it's like being on bail but you're kept in prison. And then I got community service, since then I've been like asking them more and more to diagnose me with chronic fatigue syndrome if they can, and they sent me to like rheumatology specialist, hematology specialist, and that this was like over a year ago, and there's been no follow-up since I saw the hematologist. And yeah, it's just, you have to keep pressing them, because there's no actual test for it. It's just like just whatever they think, and they'll check whether you have other diseases that could cause the same sort of symptoms, but that's like a long list of things that takes a long time. It really depends on the doctors and stuff. Depends on the doctors in question. Yeah, it's like the attitude of the NHS and the society in general towards the disease doesn't help, and that is like a lot of the attitude society has is like reinforced or guided by the attitude of the doctors and the media. So that's one of the problems, like why it's hard to get research done and diagnostic tests for the disease and all this. Just it's hard to get people to take it seriously because of the stupid doctors who are just woefully ignorant about it. And even with long COVID, so long COVID is very similar to chronic fatigue syndrome, if not the same thing. It's kind of like the same thing with extra bits added on, but like the symptoms are very similar. A lot of the symptoms are very, very similar, which has led a lot of people to conclude that it's the same disease. And that should have added loads of legitimacy to chronic fatigue syndrome as well. But the long COVID people have been let down and kind of gaslighted in a similar way. But it's crazy because people have kind of given the impression that they're trying to help the long COVID and they're taking it seriously and whatever. But if you look at the result of where things stand, it's really turned out quite similar actually to the position that the chronic fatigue syndrome patients are in. So yeah, after long COVID, loads and loads and loads of people now have chronic fatigue syndrome like symptoms. It was already quite a common disease, like more common than you'd think. I heard there was like 2 million in the US out of like a population of like supposedly 300 million. So it's quite common. But what I heard from my doctors is all of the allergy clinics and stuff, and like food allergy clinics and stuff in the UK are overburdened now, swamped by long COVID patients. So that proves that it does exist, and it is causing those symptoms. So yeah, I have, when I had to go to like court and I had to explain to the judges like why I was kind of reacting poorly to the demands of the community service role that I was offered, which was like gardening. It was like landscape. It was like heavy physical work, and I had to explain like I can do this work placement, but I need to be in like a library or something where it's not like fucking hard labour, and they wouldn't have it. It was like they couldn't fucking organise anything like that. They couldn't go outside of the guidelines and the systems exactly like with the NHS, where they can't, scan the whole fucking body, or like think to put the tube down a little bit further or put the camera down. Just think with their brain that if the cancer's in the mouth, it could have gone down towards the stomach or whatever. Can't do that. Have to follow like procedures and just only do what my job asked me to do. Fucking stupid people. And so I look stupid in front of the judge. I look like a fucking lying chav or whatever that's just trying to like blag their way out of punishment because the fucking doctors can't do their job properly. So that's the situation I've had to deal with in the past couple of years, although that's all been like sorted out by now. The other thing is the disease that I've had since prison. Since coming out of prison, and this definitely wasn't a problem before, had all kinds of new symptoms, but mostly the initial one was just neurological deterioration, issues with my memory, ability to learn things, and ability to draw and stuff like that. Things that I was good at and I was like rapidly improving at or learning new things, I could no longer do them. Then I started I had stomach gas issues as well that would come and go, and I had extreme tiredness and crashiness that was different to my normal chronic fatigue syndrome. Increased hypersensitivity to the carpets, which is why we had a pink carpet in here that I didn't want because my dad replaced my original carpet a few years ago, like 4 or 5 years ago, so I didn't want this pink carpet, but it was a kind of a new one. When I come back, I was kind of okay with it, but when I come back from prison, suddenly I couldn't tolerate this one and the ones in the hallway, and so got rid of it and put this floor down. Originally I couldn't tolerate this floor, it made me feel ill. Had to paint it with a special varnish, which you can kind of see, but that's taken me like a long time to do. Slowly done that this year, and now I can use the room as long as I've got the windows open, and it helps to have these purifiers on. But yeah, so I had weird neurological issues as well. Had like weird shooting pain sensations and swirling pressure. Felt like someone was like pinching me behind the ear. Shortness of breath episodes. Became hypersensitivity to one bedroom when my brother lived here briefly, and he stressed me out and kept fucking talking through the floor. I was up there, he was in here, kept fucking talking all night loudly, and it stressed me out, and that made me become hypersensitive to that room up there, so I could no longer go in there. Similar thing happened in my summer house, but in that instance it was caused by heavy rain. It seemed to be caused by heavy rain, which caused mold to grow, and that's when I started having issues in there. So that started with sore throat, but that was more gradual. I can't go in there at all. Nothing I tried has fixed that, actually, which makes sense if it's mold. But this one was instantaneous. Then I started having diabetes insipidus, which is when you urinate like frequently, like constantly, like you can't keep water inside you, it just comes out again. You're constantly dehydrated. I had like weak wrists. I had like cysts. Like I've still got a cyst growing. Like I've still got one of them in this finger here, like here. Showed them to the doctor. I didn't really push the doctors on it last year because it was kind of like vague symptoms, and it was mostly the diabetes insipidus that was the issue. Had a period of high blood pressure that the doctors couldn't explain. That happened after stress again. These stupid bandits were like digging up the whole road outside behind our house to put in this high-speed fibre internet so people can do degenerate stuff better. I don't know. It's fucking nonsense. This whole area is fucked. Like, whole area of the country is just fucked. Did ECG, it didn't show anything. I was taking like blood pressure readings at home, but when I went into the doctor to do it, and I did it there, they said, "Oh, it's a bit high, but that's normal because you're in the doctor's surgery, so it's normal to be nervous." I'm like, no, that's actually a bit lower than the readings I get at home. And you aren't fucking listening to what I'm telling you. I've recorded this. Look, I literally recorded them all on here actually. 143/90. 153/89. 140/85. Like, yeah, that part I felt like I was gonna die, to be honest. But that passed after a few weeks. I would go out riding and I would have to sit down. I would have to lay down because I felt like I was dying. Then it kind of got a bit better, and then still had the dehydration problems. But going into winter, I started to become even more chemical hypersensitive. Then I became very sensitive to laundry detergent. I could, when the tumble dryer was running in the kitchen, I could smell it in the bedroom upstairs. It was keeping me awake. I hated air fresheners, so-called air fresheners. What a bullshit name. Like Febreze. Moved downstairs. I was sleeping downstairs sometimes in the living room because the air was better, and then eventually I had to move. I became hypersensitive to the other bed, the spare bedroom. Had to move downstairs. Slept next to the door. Since April, I slept in a tent. I've slowly got this room better. I've got like a massive chemical filter in here, but I haven't hooked it up yet. It's going to connect to that thing for the winter. But basically, through my own research, through spending like, thousands, I don't know, doing my own tests, paying for all my own tests, which I've sent the fucking doctors some of the results for, and they say, "Oh, we want you to do our tests because we don't trust these commercial tests because we don't know how they were calibrated." What a fucking bullshit. Yeah, fuck you. I eventually figured out that the most likely cause for all of my symptoms since 2020 was a deficiency of a common vitamin called vitamin B1, which is this stuff here and this one. So that's all I needed to do, was take these tablets, was take these capsules, like 1 or 2 a day. That probably would have solved all of my problems, but the doctors didn't know that. It's fucking ridiculous. It's a disease called beriberi, and it happens when you eat a lot of carbs that have been processed, or they haven't been fortified properly with thiamine. and it was a problem in Asia particularly. The Asians have known about this disease for like thousands of years. It can kill you, and to be honest, before I started, around the time I started taking these, I felt like I was having heart problems, to be honest, like strain in my chest when I was exerting myself, like beyond normal, which could just be like walking like a few hundred meters, like quickly or up a hill. But that's actually cleared up now that I've taken these vitamins. So, yeah. And it can also be caused by stress, chronic stress, like being sent to prison, being under investigation for like thought crimes or whatever, having your area where you live in like invaded by hundreds and thousands of people. Like thousands and thousands of people have like moved into these new build houses in this town. What you can see here out of my window is how the town used to be and how it's been. These houses were built in the 1970s. This is the atmosphere of the town, but as soon as you go just like back behind there, past those trees, there's a big main road. Across that is like thousands of new build houses, and if you go right to the end of the path where the big roundabout is, it basically turns into like a city kind of atmosphere, like London. This whole town is this whole area is becoming like a suburb of London, and it wasn't like this at all like 10 years ago. So yeah, fucking the absolute state of the United Kingdom.